This week on the Conspiracy Cabal, we're taking a look at pharmaceutical companies, aka Big Pharma, and cancer treatments. I'm investigative journalist Richard Baker.
And I'm Dr. Nick Coatsworth, medical doctor and academic. And welcome back, Kabbalistas, to this episode. It's going to be one that's pretty close to my heart, Rich, as we search for that elusive kernel of truth.
That's right. And just for people out there, the kernel of truth is the origin of a conspiracy. And that's what we're after on this show. How did this all start? And just because we're talking about something doesn't mean we're endorsing it or saying it's true. But what we are trying to find is that point of origin.
So we might say the moon is made of cheese. We don't genuinely think that the moon is made of cheese, but we genuinely want to know why people might think that way.
Spot on, Nick. Let's cue up that theme music and get into it.
Let's do it.
I have 3 friends. All 3 of them had stage 4 cancer. All 3 of them don't have cancer right now at all.
And what did they take?
Jesus. They took some, what you've heard they've taken.
Ivermectin?
Fenbendazole.
Fenbendazole, yeah. I'm hearing that a lot.
They drank hydrochloride something or other.
There's studies on that now where people have proven that
people drinking methylene blue and stuff like that.
Yeah, methylene blue, which was a fabric dye.
Yeah, this stuff works, man.
Series 1 of Conspiracy Cabal is proudly supported by Whole Life. Whole Life is an Australian pharmacy and wellness retailer with stores across the country and an easy-to-use online platform offering over 6,000 pharmacy and lifestyle essentials. Whether you prefer to shop in-store or online, you can browse their range at wholelife.com.au. Orders over $69 receive free shipping Australia-wide. If you'd like to support the show, use the code CABAL10 at checkout to receive $10 off your first online order when you spend $50 or more. Terms and conditions apply.
The clip at the start of the episode was Mel Gibson on Joe Rogan. Would you take advice, medical advice from Mel?
I would not, but and that's going to be a really obvious and predictable response from me as the physician. There's some sort of claim that the cure for cancer is here, but somehow it's being suppressed. But if people go back to one of the earlier episodes, I think it was about a year ago now, and Mel Gibson's talking about how he got stem cell treatment for his lungs, and that it effectively cured his emphysema after years of smoking. And the funniest thing that you will observe when you see that, Rich, is that he pauses every sort of phrase so that he can take a breath in because he's got emphysema and the stem cells didn't work. So, Rich, to open this up today, we're actually going to take a bit of a deep dive into a very personal experience of your own. So let me say straight up front, thank you for sharing this, but tell the listeners a little bit about your experience here.
Well, yeah, I'm one of those people, one of the many out there that has had to fight a cancer. In my case, it's a non-Hodgkin lymphoma called follicular lymphoma, which I was diagnosed with at the age of 37. And this is so that's 2015. These things can just come out of nowhere. We were literally going on a family holiday to Bali the next day or the day after, and I'd felt fine. I was riding my bike into work every day, still playing good, decent level of cricket. I'd only retired from playing footy 5 years before. And I had this stomach pain for about a week or two. I just thought I was eating way too many sourdough toasties, and I was just a bit blocked up. And but I had a pulse, like a real you could feel.
You feel something pulsing away, the pain.
Yeah, in my lower abdomen. And my wife works in the veterinary industry. She goes, that doesn't feel right. You should go and get checked out. And so go to the GP, and I've got a great GP, and she felt around and just said, go and get an ultrasound now. You're going to Bali tomorrow. It's probably not going to be this, but I want to rule out like an aneurysm or something going to happen in you, because if you're in the plane and that happens, you're gone.
Your cactus.
So go there, get the ultrasound, and the ultrasonographer they're worried look, and he just goes, you got to go straight back to your GP. And I go, that's not good. And he goes, just go straight back. So I get back there and she's in tears. She's our family doctor, and she goes, looks like you've got a massive tumours in your abdomen. I've got an appointment with a haematologist for you tomorrow. You're not going to Bali.
Oh, man.
And so, and then, so I was treated with radiation therapy and chemo, and that worked. I had a full response, and this type of non-Hodgkin's lymphoma is treatable, but really difficult. They say it's incurable. So I got to 2021, and I'd literally had my checkup with my haematologist 2 weeks, and he goes, I don't want to tempt fate, and I'm not blaming him for this, by the way, at all. He goes, I don't think you'll see this again. I think, we're nearly 6 years.
Oh no, he put the mockers on you.
2 weeks later, I was watching some local footy, and I just go to get in the car, and I catch my reflection in the window of the car door, and I just saw 2 lumps in my neck, and went back to him, and he goes, well, these weren't here 2 weeks ago. And it had come back, and I had to treat it. It was more aggressive, so I had to, do 6 rounds of chemotherapy that time, and touch wood. And I don't want to curse myself by talking about it now, but I've always maintained really good health, through that journey. But it certainly makes me interested in this topic, because the amount of times I just thought, far out, I wish there was can't there just be something that I can just take, or they can inject into me that just kills this and means it never comes back. But the reality is it's not that simple.
Well, that's the thing. And so I think what you're saying there is what so many people must feel, Rich, that they just, you just wonder, why hasn't science cured this?
Yeah, why hasn't it? Tell us about, you're the doctor here. We think of cancer as a word, right? But it's a catch-all.
It is, and I think this is, this is part of the problem with the information that's going around at the moment. A lot of it on podcasts like this one, and the term misinformation is overused. But when we talk about people saying there's a cure for cancer, I think there's a genuine misinformation there, but born out of misunderstanding of what cancer is. And to understand, you've got to go all the way back to sort of the 4th and 5th century BC, in fact, where the word cancer originated, which was an ancient Greek word. It was kanakaros, and that actually it meant the crab. We know that because of the constellations, but it was something that was sort of crab-like and progressive and moved throughout the body. And I'll just read this to you, which was attributed to a Greek philosopher called Memnon, but he wrote about someone with cancer, and this is what he wrote. This man, while still living and oppressed by old age, entrusted his rule to Timotheus, the elder of his nephews. After a short time, he became afflicted by an incurable and most painful disease. For a kanakaros which had developed between his groin and his scrotum advanced the spreading ulcer quite painfully towards his innards. From out of the open flesh flowed seropurulent discharges, sending forth an offensive and insufferable odour, so that neither his retinue nor his doctors could any longer endure the foul and intolerable smell of putrefaction. That's pretty major, doesn't it?
Sounds worse than mine.
It evokes that idea of something sort of progressive, getting worse, you're getting weaker. And in that sort of sense, cancers are very similar. So not only are there those sort of common symptoms that we think of someone who's suffering from cancer and is getting worse, but at a cellular level, there's also some commonalities. The cancer cells are proliferating in an uncontrolled way. So what usually happens with our cells is that they start, they grow, they die, by and large over our lives, and that cell death is a programmed process. There's individual molecular stuff going on. That is blocked, or we call it dysregulated with cancer, so that proliferation starts to go unchecked and the cells are not dying when they should do. And this is where they almost become different diseases, Rich. Now, you experienced something called lymphoma. It was even a subtype of lymphoma called follicular lymphoma. And so that's different to other types of lymphoma, which is that's a blood cancer. It's not a solid organ tumor like prostate or gastric or lung. And they all have different pathways and different cellular signaling pathways. The more we learn about it, the more they should be treated almost as different diseases with some sort of commonality. But in actual fact, our oncologists at the moment, the people who are treating cancer, they're so subspecialized now that I know some people who treat prostate who won't treat lung because it's just a different sort of thing. So I think that's one of the confusing aspects. So when someone comes along and says, okay, I've got a cure for cancer, it actually doesn't make any sort of sense at all, because you're saying that you can cure all these diseases, which are in fact different diseases.
Understandably, people will latch onto the headline in that and the word cure and just want to believe so bad. And then when you're hearing things like with the clip from Mel Gibson and stuff like that, there is that panacea or something out there, it does make you wonder. And we know, like, when you're a patient or whatever, and we're fortunate here in Australia to have access to such good treatments that I was treated with like a monoclonal antibody, right?
Yep.
That Rituxan, I think.
Rituximab.
Yeah. And that would have cost billions to actually test, make, create. And I think that entered treatment in 1997, and it's still one of the most effective things now. So that tells me, one, the money, which I guess is where conspiracy comes in, because money talks and everyone wants a return on investment.
Yeah, and I think that's the thing, isn't it? You have just mentioned a drug, and we'll go through a lot of them during this episode. But rituximab, along with anything really that's got an AB or an IB on it, they're the things that are really targeting down to the cellular level the processes that are involved, the stopping that replication. They're used for cancer, autoimmune diseases, all sorts of things, and they do cost billions of dollars to make, but at the same time, it's the fact that there is so much money out there in pharma that I think people then do get this idea, well, if you've got that much money, surely science is advanced enough and we know enough that you must be either hiding something or you must be diverting the money in another direction. There is some reason why we haven't got a cure for this. And one of the big ones that's come out is that we're not using drugs that are in existence at the moment because they're not profitable. And this is a big Rogan, Mel Gibson, and other sort of podcaster type attitude. They're looking at these drugs and saying, well, we know the answer.
So on the way in today, Nick, out the front of the building here at the studio, you had half like a halloumi wrap going on. Why only eat half?
It was delicious, mate. And halloumi and mushroom, to be honest, and that's kind of, for those of you that don't live in Abbotsford in Melbourne, that's like bacon and eggs. It was really good. But if you eat half of something and wait for 10 minutes, then your satiety reflex kicks in and you don't want any more. And that just gives your body a little bit of a chance to digest without me going all sort of, heavy belly, can't do a podcast sort of vibe. So I reckon that's a great health message.
Maybe I should have been going to wholelife.com.au. Whole Life are our sponsors of Season 1 on Conspiracy Cabal. And, mate, they have got an enormous range in online and physical retail stores.
Yeah, they do, mate. And it's great to have a series partner with us for Series 1, dedicated to that curiosity and inquiry and good health, mate. It's not a conspiracy, that's for sure.
It's not. And for listeners of this podcast, there's a special deal for you. If you use the code CABAL10 at checkout, you're going to get $10 off your first online order when you spend $50 or more on their range of over 6,000 pharmacy and lifestyle essentials.
And if that wasn't enough, mate, you'll also get free shipping if you order over $69 worth of those products Australia-wide. And terms and conditions do apply.
What's top of mind, A-grade scandal pharma, it's Purdue and Oxycontin in America. I mean, I think a lot of our listeners out there will have seen either documentaries on streaming platforms or dramas that have been inspired. I read a great book called Empire of Pain by Patrick Radden Keefe. Really, really talented American investigative journalist and writer, which chronicled the Purdue family and their brilliance, firstly, at marketing Oxy back in the 50s. They actually owned not only this little pharmaceutical company, but they pioneered medical advertising and the conferences where sponsorship and incentivization of doctors. So they were two things.
This is the Sacklers, right?
This is the Sacklers. Yeah. Purdue Pharma was their company, but the Sackler family, that's right. Sorry, I might have misspoke there, but the Sackler family. And it's a great story about advertising, and it's a great story about cover-ups internally, and what happens to whistleblowers and how long truth can be suppressed. And in their case, that because they made so much money, they did have they donated to museums and to this and to that, and they had political protection. And you combine all of those things together, and that does invite conspiracy.
Well, it doesn't just invite. It's a 10 out of 10.
Yeah.
That's what it was. And I remember very clearly as a junior doctor when OxyContin came out, even though it wasn't as aggressively marketed over here, I still remember myself saying, oh yeah, this one's better than MS-Contin because it's non-addictive. And that was the whole thing. Though it even came into to Australian hospitals and very quickly we stopped saying that because it was obviously untrue. But I think that's just an example of how it can permeate through legitimate medical discourse and yet be something that's completely damaging and indeed fabricated. So it can happen.
So with OxyContin here, why do you think it didn't take hold in Australia like it devastated parts of particularly rural America?
Yeah, I don't know. I mean, I think there's going to be a lot of social reasons for that because that was more of the black market side. I was kind of talking about why didn't that idea of it being pushed aggressively by the medical profession, and that's because we've got different regulations here. We're less inclined now to allow pharma to sponsor doctors. I mean, when I was going through medical school, we were kind of looking forward to the end of medical school because we'd get free tickets to the Bledisloe Cup from pharma. But that actually stopped whilst I was at medical school.
Damn.
Oh, damn. Not really. Objectively a good thing.
Yeah.
And to be honest, eventually you can pay for your own ticket, so you should. So, that sort of thing, that's why I think in Australia the environment is slightly more protective. But just off the top of our head, a couple more examples of problems. We've had Vioxx, which was an anti-inflammatory, which predisposed more people to, I think, heart disease or heart attacks. Had to be pulled eventually, but it took a long time. There's Sosfubavir. I've munted that name, I'm sure, which is a problem because it's an infectious disease drug, and I should know, but that's for hepatitis C.
Okay.
So that came out, and they were charging in the US $1,000 a pill for that, Gilead Sciences. And then they would go around the world trying to challenge the production of this as a generic medicine. And the counter argument was that this isn't actually worthy of a patent. It's just it's an extension of what we already know. So there were cases in China, there were cases in Brazil, there were cases in India where all of the BRICS nations and their really big generic drug companies were trying to produce this at $1 a day, and you had the US pharmaceutical company trying to challenge this thing that they were giving to US citizens at $1,000 a day. So it is just like it's that poor corporate behavior that gives you the link between, then Rogan and Mel Gibson, people going, yeah, I've heard about these pharmaceutical companies, they're terrible. Obviously, it doesn't mean that there's a cure for cancer, but it gives people something to latch onto, and people talking about the practices of the industry.
Yeah, well, it legitimizes a reason for believing that they're holding something back.
It does. When the majority of the time, it is clearly not the case.
But then, ivermectin, that's the drug that they're talking about. What's its use? Where did it come from, and what was it originally used for?
It's so. Just circling back all the way to what these drugs do. So you've got a cell that's sort of proliferating in an uncontrolled way, and then you've got medications that will stop that, or and in some cases kill that cell. And you want to try and kill rapidly dividing cells. So anything that's going to work against a cell in a test tube is a potential candidate. Now, ivermectin is used as an antiparasitic drug. So in fact, the 2015 Nobel Prize was given to William C. Campbell and a guy called Satoshi Omura from Japan for using ivermectin, or discovering that it was useful for something called filariasis, which is a parasitic disease found in the developing world, and river blindness, which is also a parasitic disease. But it's an antiparasitic. It works very well for those things. It is therefore an antibiotic. It stops cells doing what they should do, and it therefore can become a target for other potential treatments of either cancers or even COVID-19.
It's because they talked about, I know back a few years when COVID was a thing, I remember ivermectin being touted in some places as a really effective treatment, and I know the FDA in America was that worried about sort of off-the-books use of ivermectin. They actually put a social media campaign out there saying, you are not a horse.
There were extraordinary steps taken around the world to stop people from using ivermectin. So ivermectin was proved not to work in a population study. So where we look at what happens actually in someone's body rather than in a test tube. And those were called the panoramic and principal studies. So there was government-funded studies in the UK. Ivermectin proven not to work. People losing their registration for prescribing it. A guy called Didier Raoult, I think in France, got really discredited for it. You can look up all the sorts of things that happen to people for promoting ivermectin. Same studies find out that the two drugs that Pharma made, molnupiravir and nirmatrelvir ritonavir, otherwise known as Paxlovid, they didn't work in people who were already vaccinated. So the early studies were done in unvaccinated individuals. These drugs worked really well. In post-vaccinated individuals, they didn't seem to do much at all. And yet no one's allowed to use ivermectin, but everybody keeps using Paxlovid and molnupiravir, to the point that in Australia, we spent in 23-24, after everyone was vaccinated, over $750 million of taxpayers' money on two drugs that probably were doing nothing.
Well, that's an invitation for a conspiracy right there,
isn't it?
Yeah.
And I mean, and this is the thing. So, same study proves ivermectin doesn't work, proves Paxlovid doesn't work if you've been vaccinated, proves that molnupiravir doesn't work if you've been vaccinated, and yet we still put a whole heap of money behind those two drugs. That's a problem, and I think that, whilst I'm a firm believer in science, firm believer in the research and development of pharmaceutical companies, there are things that we're doing that are not doing favours for the reputation of either science or pharma or government, and I think that's a really good example.
It's a great example. I had no idea about that. Getting on, so if we take going back to ivermectin and what Mel and Joe were on about there, where is it at in terms of its studies? You mentioned there's been some test tube or preclinical work. Can you take me through where ivermectin is in regards to its efficacy with cancer cells?
I don't really think there's too much out there beyond the theoretical at this stage, Rich. And I think when you remember I was talking about all those different cellular pathways that mediate cancer and the proliferation of cells, it does seem that ivermectin can interrupt some of those cellular pathways. So that seems to be a fairly strong theoretical basis for taking it to the next level. Then I think where Mel and Joe probably start to have a little bit of traction is not that ivermectin actually cures cancer. I don't think it does. But why hasn't it been studied? Now, that's a really interesting issue. Well, because it's a very inexpensive drug. And why would you put the tens of millions going to hundreds of millions of dollars required to run the sort of trials to prove that a drug works for cancer when there's no ROI at the end of it? Now, you wouldn't if you were a corporation. You wouldn't if you were a pharmaceutical company. You can understand that. But the problem, I think, here is that there's probably not enough public funding. Government should step in. If for these old drugs that we want to repurpose and we want to tackle some of the most devastating diseases we've got, I mean, cancer, who doesn't want a cure for cancer? Then the government needs to step in and actually fund these trials because it is true that it's not being done by the pharmaceutical companies.
Well, it sounds like with what it shows in those test tube laboratory trials that like you say, there's a basis for taking it to the next level, which what would be animal studies? Yeah,
so you go the theory, which you can establish by growing cancer cells in a laboratory and seeing if things work. This applies for one of the other drugs, which we'll discuss later, methylene blue. And then you take it to animal, and then you take it to human safety, and then you take it to human effectiveness, and then finally you compare it with other trials. And that's the scientific process. But it starts with, is there a reasonable hypothesis here? And it looks like there is a reasonable hypothesis. It's just that, we've got a lot of popular figures at the moment that have just leapt forward over all those steps and ended up with, go and take ivermectin, fenbendazole, methyl blue, and you'll be fixed.
Yeah. It's interesting. This is like off topic in a way with cancer and ivermectin and that, but I was just reading a report in the Fin Review recently about peptides and teenage boys and wanting to get jacked in the gym and all sorts of stuff, and you can buy them from influencers. I mean, this is where we're getting to, and that's it's pretty dangerous.
Yeah, I mean, it was only in 2016 that, you had most of the Essendon football team sanctioned and Stephen Dank held out as the peptide guy. This was James Hird. This was an Australian hero. So peptides within the space of 9 years have gone from villain to hero. Now, I got some pretty serious problems in my shoulder and knee tendons, but I'm not going to be injecting peptides to try and fix them. I'll just do physio and eat well and lose a bit of weight.
Yeah, fair enough. So methylene blue, what is that? I don't even know what it is.
It's an industrial dye, and it's clearly blue, and it happens to have some really interesting properties with regard to cancer cells. So it's taken up by them. You can use it to work out which lymph nodes to take out. If in someone who needs a clearance of their lymph nodes for draining cancer cells. But there's a particular property about it, and people would have heard of the term oxidative stress or oxidation, where if you've got to, and we, detox, we go into detox, we want to get rid of oxidative stress in our body. There's a sort of common colloquial version of it.
Or red wine has antioxidants.
Red wine having antioxidant effects.
Which will then send you to detox if you have too much.
Blueberries. Can't have too many of those because of the pesticides, but that'll be another episode. So there's this idea that methyl blue has this effect on oxidation. And even more than that, so taken up by the cancer cells, can oxidize them under a certain wavelength of red light. It's called photodynamic therapy. So there does appear, and I'm not an expert on this, but there does appear to be reasonable evidence that it has been used. Certainly, so theoretical tick, test tube tick, whether it's gone into the next stage of actually using it on humans. I think there might have been some stuff in melanoma on this, but again, it's the promise, isn't it? I mean, if I had told you back in 2015, or if you'd listened to, if Rogan was around then and you'd listened to him and said, okay, methyl blue plus ivermectin plus fenbendazole, you probably would have, at the very least, you would have been asking your hematologist about it.
I would have for sure. Yeah, I would have gone, what about this? Joe Rogan said, no, I would, but you would because you want hope. And Imagine again, getting back to cost. I don't think methyl blue would be super expensive to produce.
No, it's very widespread, and like ivermectin, like fenbendazole, I think it is a candidate. Like we call it candidate drugs for actually a therapeutic effect. I think in this podcast we're suggesting that they're good candidate drugs for a conspiracy because they are cheap. They do have a theoretical and test tube basis for them, and it does appear that they're not perhaps as well researched as one might expect for something that has that sort of potential theoretical application.
So there's an opportunity there, and I think we're just going to play a couple of clips now because you get on social media and it's very easy to find proponents for methyl blue.
So easy. Let's have a look.
You've heard the buzz about methylene blue, but does it really target cancer? Yes?
Start with the big blue elephant in the room, methylene blue. Everywhere on the internet, methylene blue seems to be cropping up. Is this like a brain booster, an energy hack? Is it anti-aging? Is it anti-cancer? Or is it just textile dye and a chemical?
My short answer will be all of the above.
We're talking about conspiracies in Big Pharma. Now, Big Pharma can do a lot of good things for society.
100%.
Invest a lot of money, employ a lot of people, all that. But history would show they're also capable of not so good. And that's where we get conspiracy and cover up. I'm a big Le Carre fan.
Oh, yeah.
And, one of his books, which actually wasn't about really spycraft or anything like that, The Constant Gardener, which was a film, I think, in the 90s. And that was basically, following a British diplomat into Africa, and his wife was a bit of an activist over there. And basically they uncovered this great, vast, pharmaceutical conspiracy around testing of dangerous HIV drugs on, African population and stuff like that. Now, that's obviously fiction, but it speaks to a mindset that is there, that these guys, that there can be great ulterior motives and hidden hands taking advantage of populations or people that perhaps don't have the resources to fight back. And there have been some real life scandals involving big pharmaceuticals.
Yeah, I mean, there certainly have. And I think, again, this is, we're sort of looking at some very high-profile cases where large corporations have behaved badly. And that happens in Big Pharma, it happens in big chemical, it happens in big anything, really. So the question is, do you take those examples, and we'll go into a couple, and say that, okay, because of this, therefore that, and the whole thing's in trouble? Or do you say, actually, hang on, we've got you, Rich, who benefited from a drug like rituximab, before which, you might not even be here.
Yeah.
Let's be frank. And that was produced through universities and then the investment of Big Pharma.
Yeah, absolutely. And I'm very, grateful for that that investment there. Okay, so we're coming to the end again here. Time to give this a ranking. So I'm going to ask the question in this way. Ivermectin as a cure for cancer right now, out of 10?
2 out of 10.
Need to study its effectiveness?
8 out of 10, 10 out of 10. We should be studying the effectiveness of all sorts of medications in a way that we're not necessarily doing now.
Okay, so my own rating, I'm obviously nowhere near as qualified as you to talk about its applicability or right now where it sits for cure for cancer. I'm gonna go 3, and yeah, I endorse what you're saying. It makes sense. If there's existing stuff that's already out there, why not give it a whirl against other things while still maintaining investment in great new things? And I think it'd be really positive just to also, in finishing off, for listeners out there that, suffering a cancer diagnosis or going through treatment, or have got friends or family doing that, that there is a positive there that like I know in the world of blood cancers, and that the last 10 years or so has seen revolution in treatment with immunotherapies, and and that's a great thing that should give us confidence in science to make further advances.
It should absolutely do that, Rich. And even in my career, which I started as a medical student in 1996, as a doctor in 2001. I mean, the top two most obvious ones for me are for Australians, the radically different outcomes in melanoma because of immune therapy, like radically different, much more survivable cancer than it used to be. And then pulmonary fibrosis, not a cancer, but having done respiratory medicine training, we had nothing when I was doing respiratory medicine in the late 2000s, and now we've got the antifibrotic drugs that are able to extend people's lives and quality of lives quite considerably, where we had nothing before. And the research keeps going apace, and the challenge is to balance the importance of the pharmaceutical industry, the critical importance to people with cancer, to people with lots of chronic diseases, with responsible corporate citizenship. And I think if we can do that, then the voices that you hear, Mel Gibson with his gravelly voice saying fenbendazole works, they'll start to get quieter and quieter, I hope.
Okay, thanks, Nick. Thanks for listening, audience. If you want to reach us with some suggestions, feedback, topic suggestions, email us at conspiracycabal@outlook.com. Follow us or find us on Instagram, Conspiracy Cabal Pod. If you're liking the show, let your friends know, share it around, put it on social media. Hopefully you're getting, something out of it. We're really trying to intelligently, as best we can, unpack conspiracy theories and explain how they get to be and why they're dominating public discourse now.
And a shout out to the voice of God and our producer, Ed Gooden. As always, my name is Dr. Nick Coatsworth, and together with Rich Baker, we're the three Kabbalistas, and you guys are too. See you next time.
Thanks for listening, guys. Come back next week. And as always, big thanks to our sponsor, Whole Life, an Australian pharmacy and wellness retailer with stores across the country and an easy-to-use online platform.
Where we both agree that good health is not a conspiracy. See you next week.